Hi there, thanks for staying tuned for this next video. So in this video I'm going to talk to you more about some of the more rarer complications that come with a dermal filler. So the first one, like I was saying about, I touched on in the previous one, may have been infection. So obviously we're pricking the surface of the skin, and infection can be introduced into the tissues. However, we reduce that risk significantly by making sure that the skin is nice and clean before we even get started. Also, as long as you're taking good care of your skin post-treatment, so you've got to do your job as well by making sure that you follow your aftercare advice, such as don't reapply your makeup for at least the next 4 hours. If you are going to put any makeup on because you're truly that anxious about people knowing that you've had any treatment, then I suggest that you go with a mineral-based makeup. That way you're reducing the amount of infection that you could possibly, but please really ideally just don't put any makeup on for the rest of today. Make sure that you're using clean brushes, sponges, whatever it is that you're putting on. Touching the face, everyone wants to touch their face as soon as they've had it done, so make sure that you've got nice clean hands. I'll give you a squirt of alcohol gel as well once we've done the treatment, just in case, because I know what you're all like. You just have to touch, don't you? But of course you've got to pretend that, you know, potentially you're going to introduce infection into that area, so just leave it be. So redness and swelling that does seem to be not getting better in time can be a sign that you've had some infection in there. So you may need to come back to clinic and be seen by myself and my prescriber to make sure that you've got some antibiotic cover. Piercing of structures underneath the skin which we wasn't intend to pierce, such as salivary glands, ligaments, muscle, bone, all live underneath the surface of the skin, and there is a really small chance that, you know, we can damage some of those structures under there. However, my training suggests that I've had lots of training over the last 3 years, and, you know, everything I do is purposely made to make sure that reduce the risk of damaging these types of structures under the surface of the skin is reduced significantly, and that may be used to the tool that I use to do the dermal filler treatment. So other reactions you can have is something lumps and bumps. Lumps and bumps can normally be felt for a couple of weeks after you had your dermal filler treatment, because that filler has got to integrate into your tissues and become dynamic with you and your movements. When I was saying though, as a nurse, once I've put a treatment with you, you're my patient now for the length of time that you've got a dermal filler within your skin, because you can have something called delayed onset nodules or lumps and bumps that sort of appear. Might be 6 months down the line, it might be a year down the line after you've had a dermal filler treatment. And we're touching on this as well because it does play a big part in the minute with our COVID vaccines or people that are having coronavirus themselves. So a small number of people are having swelling and an ouchy sort of sensation where their dermal filler has been, either after contracting a virus of any kind. It can be, this is not just specific to COVID. This has happened with people that have had flu or had the flu vaccine or got a virus by eating something bad on holiday. Their dermal filler has swollen up, but then it's disappeared after a couple of days, and then nothing's thought about it. These are called delayed onset nodules. Very rarely these can turn into abscesses and that need to have antibiotic cover. This is part of your immune response. Your body just goes into a heightened response and it just tries to find what is it that's causing me to be unwell, and people are finding that the dermal filler is swelling, and so the body's immune response, just like when you get a headache or your joints ache, your body is just flushed out loads of inflammation, fighting goodies to everywhere in your body, and it just sort of attaches itself to certain things such as bones when you ache, or dermal filler in this case. So what we are saying now, if it's not settling after you've got better, you may need to come back to clinic to have some steroids to help reduce that inflammation. With it comes to the dermal fillers and having a COVID vaccine. Now, if you were to have a COVID vaccine and then your filler was to swell up, and you needed the steroid cover, now the steroids actually reduce the efficacy of the vaccine, And so obviously the vaccine takes precedence in this case. So we are saying that people, if they want to have a dermal filler treatment, you need to either wait 2 weeks, so you have your filler 2 weeks prior to your vaccine, or you wait 3 weeks after you've had your vaccine. So we know that the vaccine is completely in your system. You're getting all the goodness that you need from it to be able to fight COVID. But it is something to take in mind, and I will be asking you about whether or not you've had a vaccine and if you've got a vaccine booked up. So so obviously the steroids, we want to make sure that sort of improves. But I was saying, like, these things can happen. It is about pre-COVID, so we were talking a 0.5%, so that's about 1 in every 200 people may have some kind of more lumpy bumpiness along the line of their dermal filler.